Okay, good morning, everyone. Thank you very much for coming. And I hope you can sustain the 4 days with me. But we're trying to get it, make it fun and entertaining and mostly educational. Because I think that's a key, but especially in this industry, a lot of things people say that's not necessarily true. You have a lot of marketing, things that really are not true. So what I'm trying to do since my days here and beyond is really to try to educate people, to let them know about the importance of nutrition, digestive enzymes, and so on. But in that, I also, first, before I start, the organization in the book, initially I was going to talk about the epigenetics and so on. The more I thought about it, and all of you are more interested in the enzymes really, so I wanted to go ahead and maybe start with the enzymes. So we will come to some of those different topics as we go along. Is that okay with everybody? Yes. They're all, it's almost a la carte, so we can start go everywhere. Let me make sure I can operate this thing. There is another concept I'm trying to pioneer in the last few years. It's a concept of what I call the 360 wellness circle. And it came to me because a lot of people talk about holistic. And when I heard the word holistic, and when I talk to people, what I heard is really holistic. For many people, it's, okay, looking at all the different organs in the body. For some, it's eating organic foods. But it should be more than that. And I remember one time, one person gave me something to think about it. We were talking about nutrition and everything, and she said, Dr. M, I'm hungry for love. I just want somebody to hug me. So I was counseling this person in nutrition, in enzyme, and so on, but I didn't go to the point where she really needs that. That means her religion, her lifestyle, what she is interested in life. Because that's what sometimes we do. We just eat this, do this, take this product, and so on. But we forget some aspect critical about the person's life. What they work, what are the conditions there? What do they live? Because now I have the concept of even human toxic and pollutants. Because the same way we talk about chemical pollutant, we also have human pollutants. Because there are people who sometimes their relationships are polluting their lives, are creating the health conditions, the health challenges they have. So that's one of the reasons I came up with this concept of 300 circle. And actually, when I call it circle, it should be a globe. It shouldn't be really a circle, because a globe is a little bit more comprehensive. So that's what I meant here. You have it in your book. So it's an inclusive, continuous network of connected body systems within a physical and social environment. That's the definition I'm giving you. So it's really the physical and the social, including what is inside, including what your body is made with first. So you have all of those interconnected parts that you have to deal with. So the body, and the other concept is the body's complex biological system. So we know all the different things that is made up, and from our parent as well as the environment. And all of those, the intricate formation of the body is under the direction of two hormones, estrogen and testosterone. This is another reason why I also focus on the circle. Because, all of you are healthcare professionals, you are first and foremost biologists. That is really a function. That is the root of your profession, biology. And every biological system, what's the purpose? What is the biological purpose of every biological system? It's procreation, it's reproduction. every biological system is guided by two hormones. Whether we accept it or not, whether we make a philosophy about it, two hormones, estrogen and testosterone. Actually, estrogen is actually the default hormone. It's the one that directs everything. So when we talk about, again, that goes also with the concept of the 360 wellness circle, because we have to take care of all those different aspects. So I'm not going to read a lot of the slides, just because I have some of those for you to be able to see and read. But it suffices to say that when you look at the body, you have to look at it many, many different things, including the physical as well as the environmental aspect, and how those different parts are interconnected. So understanding the body's biological purpose and following its natural developmental stages, that is a fundamental, that represents the fundamentals of wellness. And unless if we don't understand that, we can never understand what we need to do to correct the body. So if somebody comes to see you, and then you say, okay, they say, okay, I have this kind of problem, I have that kind of problem, so you say, okay, you need to take this. You didn't ask them about their age, especially if it's a female, you never ask about where they are in the reproductive cycle. You miss the point. Because if you don't ask somebody about where they are in their biological system, you cannot help them properly. So, fundamental to everything I want to do in terms of wellness, I always go back to the developmental stages. And that's the reason I say everybody has to look at the body, and first as a biologist, and second to focus on the reproductive cycle, the purpose, the biological purpose of why we are here. And every aspect of our body is based on those hormones. So first, conception to fetal growth, we have different hormones regulating every system in the body. Postnatal to adolescence, again, that's controlled by hormones, and especially either estrogen or testosterone. Everything else comes to fit into those two. Those are the masters. Those are what I call the CEOs of the body. And then you have the puberty, maturation, reproductive function, reproductive pause and senescence, and all of those within of course, the physical, nutritional, and social environment of the body. So those developmental stages, the same way we look at developmental stages of worms, of larvae, of other things, we have to also look at developmental stages for the body. Now, the other concept I'm pioneering is what I call the BPS. The same way everybody talk about GPS, geographical positioning system. I'm talking about the biological positioning system. Where am I today in my biology? If somebody wants to find you, they can find you today here because they can look at your GPS. So what I want to develop, in fact, this chart that Susie just showed you, I'm calling it now the BPS chart. This is a BPS chart, and I'm working on it. In fact, one of the things I've been trying to get it digitized. I've had several developers trying to get what I want, but finally I have somebody who I think may be able to do that. And I want to, because everybody in the world has a cell phone. I wanted to make an app that everybody can have. So if you go to somebody, you go say, okay, they say I have a diabetes. You want to know where you come from to get the diabetes and where you're going to go from that. And I also want all of you healthcare professionals to use this as a teaching tool. If a patient comes to you, you can show them where they are. And then you say, okay, you are here because you came from this place. Those are the living conditions that you have adopted that brought you here. And from there, if you don't go with, you don't comply, you don't do the necessary things, you may move to another stage. The visual thing helps a lot. The visual thing helps a lot. And that's one of the reasons also why I thought that as I traveled around, I said, everybody in the world has a cell phone. So what about you just making it where everybody can have it on their cell phone? And then people can just determine. If you go to the doctor, they say, oh, you have a high cholesterol. Some people don't know. They say, oh, but high cholesterol, how did I get there? People think it's no, it's a lot of those kind of things. So that's why I come up with the concept of biological positioning system, GPS. So the physiology, anatomy, biochemistry, everything in the body are relative and individualized. This set of facts must be an important factor, and it's dynamic, it's evolving. My body is not where it is yesterday. Between yesterday and today is different. A lot of metabolic things happen, even from this morning to now. What I usually say in my lectures, from this morning to now, all of us have had potential cancer cells in our bodies. But fortunately, the body can detect them very quickly, and it's like if you ask me to type a lot of things very quickly on the computer, you will see those red things in the mistakes I make. And that's the same for the body, because as you demand a lot from the body, if your DNA repair system is working properly, if you're eating well, and if you're under controlled stress, you are in a good, happy environment, your body can detect all of those and correct it. But if not, over time, those mistakes stay, and some of them can be cancerogenic. So it is important to understand one's biological journey in order to influence one's biological destination. That's very important. You need to know where you are. And I know some of you have, several years ago, have come to some of the lectures I gave here, where you look at the development of the baby and so on. And I'm sure even Dicky has continued to teach that. And that is because we believe there is a journey that starts from the womb. And the womb, or the fertilization, the stage where the sperm and the egg meet, that is just a physical landmark we can trace. But things may have happened before that, before those two set of DNA meet. So it's just a matter of always look at where you come from and where you want to go. If you don't understand that, you cannot you want to be able to treat somebody or be able to take care of their health. The key part of the circle of awareness, again, all the different parts that are here, in fact, I think it's similar to what Dicky called it.
System 11?
System 11, yeah. It's similar to that concept. So what does make all these parts connect and be integrated? This is just one aspect that I want people to focus on, because again, I think that this person has told me one time, because I realize that a lot of times, whether it's at home or whether it's at work, people, this makes a very important thing in our life, to be happy. To be happy, it's a very important aspect of health and wellness. And so that is when I put this picture in this slide in, just to show the different aspects of it. And even animals, we can see how even animals usually go for that sense of love, a sense of connection, because it helps with the cortisol, it helps with the whole stress hormones, it helps with the immune system. So we have to figure out how. That reason I'm saying, if somebody comes to see you, you need to go beyond what the symptoms they're talking about. You need to see what is their life environment, living environment. Both the chemicals around them, the work environment, the social environment, and so on and so forth. So those parts, those ones that I showed you in terms of that show this kind of connection, this kind of feeling of love and so on, that keeps the body, that keeps everything integrated. All of you as the professionals and the business people, you cannot manage anything if things are in disarray, if things are not connected. You have to have things connected in order to be able to manage them successfully. That's the same thing for the body. And so when we don't have that, so we will look at what are the things that disconnect, disintegrate those parts and promote onset of disease and prevent proper healing. Those are the conditions. So when you have a patient, if you don't know where they come from, being sad, being crying and not happy, all those kind of things. How many people go through those kind of things every day? You can give them the best product of the world. You will not be able to make a good dent in their health. So you have to put that part of your system. And that's actually what this lady taught me when she said, I'm hungry of love. Then it reminded me, I say, everyone would say I'm hungry of food or whatever, but I'm hungry of, I've never even thought about the concept. Then I started saying, this is something I need to pay attention to. I remember one time another person told me, a lady told me, and I say that sometimes because you mentioned here, overseas I was in Central America, and we're talking about this lady said, what you saying really touched me, because sometimes my husband and I will plan to go outside to go to dinner or something, and I will go and I get ready and so on and so forth, and everything, and I will come and ask him, I say, how do I look? And he looks at me and he said, let me think about it. Can you imagine that person outside? Can you imagine how that person, what kind of living that person? You can propose any kind of food for them, any kind of nutrition for them. You are not going to help them. And so those are the kind of things that, and it happens in life. A lot of those kind of things happen, but those are really that make me focus on this whole concept. And of course, we have also another aspect, those environmental conditions. So in addition to the social thing that can disintegrate the body, we also have various, those are some of the few environmental issues that can also affect the body. So example of negative emotions that are linked to the health challenge. So repressed anger, migraines, chronic back pain, and fibromyalgia. Sometimes people get, they feel bad and they keep it inside. And again, let me give you another example. I'll tell you what happened when I was here, Transformation, and I was giving a lecture. I don't know, I think I forget where. It wasn't in the building here, it was somewhere in one of the hotels that we were having a seminar. And I was talking that day, I was having a lecture on the biological cost of cortisol. And I made a lecture, and during the break, a doctor from Flagstaff, Arizona, came to me. He said, Dr. M, what you said really makes sense to me. I said, what do you mean? And he told me, I think actually I had him come to tell the story to the group, I don't remember exactly. But in the break, what he told me, he said he had a patient, a lady patient. She had some kind of skin condition on her arm. And she did everything. Nutritional therapy, allopathic therapy, all kind of stress management, all kind of things. Nothing has worked on that. And she came to see him because he's a MD, but also into allopathic holistic medicine. She came to see him to see if he can help. So he started asking her questions. When did it start? She said, at that time when he was telling me the story, she told him, oh, it started about 17 years ago. She said, 17 years you have this, you never been able to do anything about it. She said, no, I was not. And he said, okay, tell me what happened. He said, actually that is the time where she found out her husband was having an affair. And according to him, she herself said the husband did everything humanly possible. Not only to stop whatever he was doing, but to really trying to, tell her that she's the one he loves, and nothing else is happening. And he asked her, he said, did you forgive him? She said, no. He said, why did you stay all this time? He said, because we have a boy and I couldn't leave. So when she was doing that, so the boy was about 16 years old at that time. Or 17 years old. And he said that, nothing is going to help you unless if you forgive. Because he did his part. And that's one of the things also I tell people. I say, all I can do, if he did something bad to me, all I can do is say, please forgive me. I did my part. I really can. Now you have the power to either forgive me or keep it. If you keep it, you hurt yourself. If you forgive me, you help yourself. Because I cannot force you to forgive me. I can only ask you to do that. But every time you keep that inside, you keep cortisol just monopolizing your body, taking control of your body. And cortisol, if you keep cortisol monopolizing your body, it's the same thing as almost like you have HIV in your body. Because it's an immunosuppressant. It suppresses your immune system. So, and that's only, so he said, you have to forgive me. Because if you're not, there's nothing. So he worked with her and so on progressively, he was able to help her. And the reason is a lot of time, in fact, many studies have done with the couple in the University of Ohio and Columbus. They did a lot of stress studies. And one of the things they found out is they follow, I don't know how many thousand women, and they found out who had cancer. And they see that all of them, their cancer started during the time when they had some kind of stress that they didn't manage. Stress happens, and it's okay. So actually it's good for us for stress to happen. But we have to manage it. We have to manage it. So one of the things, one of the expressions I use sometimes to people, I say, be a Teflon. Not because I believe in necessarily in the Teflon properties in the cooking, but as a Teflon because nothing sticks on it. So it doesn't stick. So what you can do is, if you hurt somebody, ask forgiveness. Make sure your forgiveness is sincere. You're asking for forgiveness is sincere. And then after that, there's nothing you can do. So those are the things so repressed anger is one of the things that a lot of people keep inside for a very long time. And so when you're dealing with a patient, you have to, of course, they're not going to tell you everything the first time. And all of you are the holistic healthcare practitioners. You are into holistic because you are not believing in just come see you, prescribe and go. You're believing in trying to build that rapport with that patient so you can get them to really feel comfortable and be able to adopt whatever treatment you try to do. So all of those different things, whether it's anger, anxiety, resentment, all of those have consequences in the body over time. So we have to control that. Healing or treatment approach. The pharmacological, which is what I refer to the allopathic process where you go and see somebody, they give you a prescription, or the holistic or comprehensive healing medicine. And you see somebody, get another example, somebody said, oh, I went to the doctor, he just looked at me, he didn't even give me a prescription, he just told me to go and eat well and do this and do that. He didn't give me anything. And because we are programmed to believe that if you go to the doctor, you have to get a prescription, you have to get some kind of pill. But the doctor telling this person, just go change lifestyle. It's not enough. And people also believe that the healthcare practitioner should be doing all the work. No, the healthcare practitioner is only a coach. It's a coach. Develops a rapport, a team with you in order to help you, to guide you. But the healthcare practitioner that's one of the reasons a lot of people now are coming to the holistic and comprehensive healing approach, because it's not just giving prescription, you have to develop a rapport with the person. So it's very important to know the person that is to be treated or healed. It's important to establish a good rapport, and it's important to know where they come from, which means what their BPS is. Patient expectation and responsibility. That's one of the expectations I was just mentioning, that this patient went to see the doctor and they expected just pill a prescription, but because the doctor didn't give a prescription, they thought that, okay, the doctor wasn't taking care of it. But that's not the case. So the patient and health professional are supposed to be partners. The healthcare is a coach, and the patient is an active player, not a passive participant. That's another thing we really need to cultivate. I know a lot of you as healthcare practitioners be trying to do that, and it takes some time. Especially if it takes which time it takes money. So that reason, actually, a lot of physicians, allopathic physicians, don't do that because as soon as they start spending too much time, the insurance companies will call them and say, "Hey, you're costing us a lot of money. You're spending too much time with this patient." And so that's one of the things that you as a holistic healthcare practitioner, you have to develop how to make the patient not be a simple passive participant. They have to be an active. They have to know that you as the coach, you are guiding them, but you are not going to do all the work for them. Now this brings me to a famous, this is the quote. I like this quote so much that I want to make sure every one of you has this quote. Because this is what I consider as, this is the key. Everybody hears about the Hippocrates thing, say, let food be your medicine, medicine be your food. We all heard that. But this is the key. This is, and why do I strongly believe in that? Because what I was saying earlier, it's more important to know what person the disease has than what disease the person has. Because that is the key foundation of what I was even referring to as the 360 wellness. And Hippocrates said that for maybe more than 400 years ago. We hardly see it. We see that let food be your medicine, medicine be your food, or so on. But we don't see that. But that is the core. That is the foundation. Now, when I pass around, sometimes I advise healthcare practitioners to make a bigger poster than what I usually give. Make a bigger poster, because what does it do? When a patient comes to see you, they will look at it. They start reading it. Now, automatically they start feeling that, hey, this person, I need to let this person know me. Before you even talk to them, they say, oh, I need to know, this person needs to know me. Because if he doesn't know me, he may not be able to help me properly. So when he tells them why you're trying to get some information from them, they will become more open to it. They will accept that. And that was, it's very important that we keep that always in, whether it's on your desk, whether the patient can see it, whether it's on the wall or somewhere, but it's been around, we don't pay attention to it, because that is where counts. If you don't do that, you are not different from what you criticize, which are the allopathic just giving prescription, because you are just addressing a symptom. You are not looking at the concept, the holistic approach, the holistic person. Holistic is not just what I eat. It's my whole living environment. It's physical, social, and whatever else. So this is fundamental.